good morning and welcome to Veal Gardens, the setting for today's COVID update for South Australia. I'm joined today by the Treasurer, the Honourable Rob Lucas, who will be able to provide us with a further update regarding that immediate support for those sectors which are most adversely affected in South Australia. But before we proceed to that, some further very sad news for South Australia, with two people passing in the 24 hours to midnight last night. These were two residents at aged care facilities in South Australia. Again, there hasn't been a determination of the cause of death, but we do know that both of these people were COVID positive at the time of their passing, and these deaths, like the other two reported in the last week, have already been referred to the coroner. Just with regards to the situation of the child who was COVID positive at the time of death yesterday, the child who was under 2 years of age, we've had some correspondence from their family this morning, and they are pleading for some privacy at this time. This is a traumatic time for their family, and certainly my condolences go out to that family and of course the family of the two people whose deaths we are reporting this morning. Yesterday we had a record day of testing in South Australia. In fact, it was our all-time record at 25,943 tests. South Australia currently has the second highest testing rate per capita in the nation, and we have the second fastest turnaround times of any jurisdiction in the nation. And so pathology in South Australia, whether it be SA pathology or our private laboratories, is under enormous pressure at the moment. It's under enormous pressure right around the country, right around the world. But relative to other jurisdictions, South Australia's pathology services are standing up extraordinarily well in very trying conditions. Yesterday, almost 26,000 tests were processed through the laboratory. Unfortunately, I do need to report a significant increase in the positive cases in South Australia. In fact, yesterday we had 2,093 positive cases through the SA pathology lab as well as the private labs in South Australia. This is in line with the very steep increases that we're seeing right around the country. It is a further increase on yesterday, and obviously this would seem to be linked to activities that occurred on or around Christmas Day. This is one of the reasons why we had to move very, very quickly on Boxing Day to try to slow the growth, the exponential growth of positive cases here in our state, because we know that many of those people will ultimately end up in hospital and in ICU. We have better news in terms of the hospitalisation statistic for South Australia. So in the 24 hours right up until midnight last night, in fact, we had 44 people in hospital in South Australia at midnight last night with COVID-related issues. And so this is still very, very well within our ability to cope in South Australia, and still just the 4 patients who are in ICU. My understanding is that clinically they're all in a stable condition, although one of those people still remains on a ventilator in South Australia. Because of the extreme heat conditions today, we are going to have to change the opening times for some of our drive-through facilities. So the drive-through facilities will not be operating between 10:30 and 5:30 this afternoon, but what we will be doing is opening them up from 5:30 this evening right through until midnight. So there will be a similar spread in terms of hours for those drive-through facilities, but there will be a different time frame for them to protect the workforce and also those waiting for a test. We've further set up an additional facility down in Manton Street, Hindmarsh. This is indoors, it's air conditioned, and this is a site which will operate from 10:30 through to 5:30. It may even be opening slightly longer, but again it requires for people to have bookings to go down to see that site at the Hindmarsh Education Centre. We did see a steady drop-off on the asymptomatic testing yesterday. You might recall that I recorded yesterday that there was a very high level of asymptomatic testing. It's It's not optimal here in South Australia, and it is using up a finite resource. So there was a drop, but it's still too high. Over 50% of all of those tests were asymptomatic tests. We've got to get that significantly down from that, so that we are freeing up that expanding test capacity in South Australia for those close contacts and also all of those people with symptoms across our state. It's very important that we do heed this message, and I do want to thank all of the people who have done the right thing, who are asymptomatic, not to use up the capacity which we really do need to preserve for those people who have symptoms or are close contacts of positive cases. In terms of vaccination, yesterday we saw a further surge in terms of the vaccination, the state-based vaccination rate. We still don't have the numbers in terms of vaccination in the primary healthcare setting, so that's the GPs and the pharmacy sector here in South Australia. I'm very grateful to all of our GPs and pharmacists who are doing everything they can to increase that vaccination rate. I've got to say that there are still appointments available for vaccination, and there are more and more coming online all the time. So if you checked yesterday, there wasn't one near you, go and check again today. When people drop out because they might have got an earlier slot, then those positions become available. And one of the most important things you can be doing in South Australia at the moment is having that vaccination, that booster, as soon as it is eligible. We know that this not only reduces the severity of the illness should you acquire it, but also, very importantly, it reduces your likelihood of getting the disease in the first place. So I want to thank all South Australians for turning up for their vaccinations. A big surge yesterday, and we're wanting to see a big surge every day going forward. Certainly we're looking at all and every single opportunity to flex up the workforce, and I want to thank those people who have stepped up, come back off their holidays to swell the capacity that we have at our vaccination clinics across South Australia. We're putting a call out to people with the skills for vaccination to step up at the moment, so that we can significantly increase our workforce in this regard. As I said earlier in the week, we will be making it mandatory for 3 doses for those sectors where we require mandatory vaccination in South Australia. We'll be obviously starting with those people who are on the front line, so those people that are working in the hospital setting, the aged care setting, residential aged care facilities, and of course residential disability sectors. These are crucial sectors for us. The Police Commissioner will be providing further update in the coming day, but suffice to say, 3 doses will become mandatory for those sectors which are already mandatory in South Australia. We want to do everything we can to protect our workforce in South Australia, preserve that workforce for the continuing surge that we're seeing right across the country. A couple of additional announcements for today. Effective immediately, there will no longer be a requirement for people coming into South Australia to use the entry check SA. This is no longer required, and there will no longer be a requirement for people coming across the border to do a rapid antigen test prior to coming into South Australia. This was discussed this morning at the COVID Ready Committee. It was not a good use of our resources at the moment, and so the entry check requirement has been removed. The rapid antigen test requirement has been removed, but we are asking all of those people coming from interstate into South Australia to observe exactly the same situation that we require of all South Australians, and that is to monitor their symptoms and to take action should they develop any symptoms. And the appropriate course of action is to isolate yourself, book in for a PCR test, and go and have that PCR test as soon as possible, but to remain isolated in the interim. The final announcement that we have today, of course, is that we will be removing the requirement for quarantine for fully vaccinated international arrivals as of midnight tonight. So there will no longer be a requirement for those people that are coming in from overseas that are fully vaccinated to do their isolation. That will be removed as of midnight tonight. It is still a requirement for those people that are not fully vaccinated to do 14 days in a Medi hotel. So we will be taking down the facility at the airport, which is currently there for the general public and for those arrivals into South Australia by air, and that will be now dedicated to those international arrivals for a quick check. They will still need to do a PCR check on arrival. That's what that facility will be doing, and as I said, the Hindmarsh Education Centre has now been stood up and available for people in this state. We're still going to be looking at every single opportunity to flex up our testing opportunities as well as our vaccination opportunities. I want to thank South Australians for observing the new level of restrictions in South Australia. Yes, there has been a further surge today. I think we're going to see the numbers bumping around a little bit at the moment. I'm very glad that we got on the front foot with the Omicron variant, putting those restrictions in place as of the 26th, and I hope that we can start to see those numbers taper off in the coming days. I'm happy to answer questions on that body of the press conference now, and then we'll talk more about support for the business sector once we've exhausted questions on this line of questioning.
When you refer to fully vaccinated, are we talking about 2 or 3 doses?
2 doses for those coming in from overseas at this point.
And why has South Australia decided to stray away from the rules or the guidelines that were made at National Cabinet yesterday in terms of the definition of a close contact?
No, I don't think that we have. We made a decision yesterday at National Cabinet, as I pointed out at yesterday's press conference, to significantly narrow down our definition of close contacts because we're at a different phase of the overall disease. So in South Australia now, you're a close contact if you're a household or intimate partner, or those 2 exceptional circumstances in South Australia if it is related to a vulnerable cohort, for example in an aged care facility, Aboriginal community, where there's no logic in narrowing that down because those 2 communities are more likely of higher level illness, and the other one of course is where we do have an identified transmission site. In addition to that, Professor Spurrier has put some guidelines out with regards to the transmission of this disease, but we're not going to be directing people as close contacts. We don't have the capacity to be doing that for this stage of the disease, but people do need to be aware that if they're out dining with somebody who is a positive case for 4 or 5 hours, it doesn't really matter whether you're living with them or not, you are going to be more vulnerable. So it's important for people to take that protection, whether it's isolating themselves, getting a test, or just simply monitoring their symptoms.
Can I follow up from that,
Yes.
please, Premier? What is the definition of a close contact? Is it 15 minutes in a room, like Professor Spurrier said on radio this morning, or is it the 4 hours which National Cabinet agreed to yesterday?
So there was no, I don't think we had an agreement on the 4 hours. We basically narrowed it down to those 2 particular areas where we had commonality across all jurisdictions, where household and intimate contacts were automatically determined as close contacts, but in addition to that we have a state-by-state exemption. Our 2 areas are for vulnerable communities and also where we have identified transmission sites. But in addition to that, in South Australia, we think it is in the best interest from a public health perspective to provide further details for people about the likely transmission from a positive case. If you have been in a household-like environment where you have spent an extended period of time with somebody, then you need to consider that for yourself, but we won't be in a position to be making a direction that they're close contacts. So we've significantly narrowed the definition of directed close contact in South Australia. We're providing further advice as to how this disease is transmitted, and of course people are going to have to look at this from their own particular circumstances. Were they wearing masks, not wearing masks? Were they indoors or were they outdoors? Were they in a confined space or not? Were they vaccinated or not? There's a lot of things to take into consideration, but from a state perspective, we've massively narrowed down those people who will go into essentially a directed close contact. I know that's going to be a big relief for somebody, for many people in South Australia, but I think everybody still needs to be aware that we are dealing with a highly transmissible variant. The Omicron variant is an absolute game changer, and so if you are in close contact, unprotected for an extended period of time, you really do need to take that into account, monitor your symptoms and potentially go into isolation.
Sorry, can I just follow up from that? Is it as little as 15 minutes? Because, that's what Professor Spurrier said on radio this morning, that the 15-minute rule still stands, Does it stand or does it not?
Well, as I was saying before, it's not as simple as 15 minutes or not, because there are so many other things. I mean, if I was standing next to you for 15 minutes and we were outdoors and you've got a mask on and I haven't, you had the disease and I didn't, you know, you're at a much lower threshold than if we're seating in a busy indoor cafe. So, look, we're issuing guidelines with regards to that, but in terms of directed close contact requiring quarantine, it's massively reduced down. But people do need to be made aware that you can still catch this disease if you're not living with somebody or in an intimate relationship, and that's just a fact. And people need to be they need to be aware of the risks associated with Omicron.
I mean, you've got to accept these rules are so confusing. They are changing hour by hour. How is the public meant to keep on top of them and know if they're a close contact, particularly if SA Health isn't releasing exposure sites? They're often not contacting people who are close contacts. What do you expect people to do?
So we are putting transmission sites up on the website, but quite frankly, many of us are going to become casual contacts in the very least with somebody with Omicron in the coming months. That is a fact, and this is why it's so important that people monitor their symptoms. This is the number one message, and that is that Omicron is very definitely the dominant variant here in Australia now. We're seeing a massive surge in some of the other states. We've seen a small surge ourselves here today. We know that things are changing and we've got to adapt to the changes of the circumstances that we're now operating in. We're trying to provide very accurate information. We know that it is updated on a daily basis, and that's why we're standing up every day to provide that accurate advice to people. So the very clear message in South Australia at the moment is Omicron is here. Omicron is highly transmissible. People need to be taking action to protect themselves, and of course, if they develop any symptoms whatsoever, they need to isolate themselves and go and have a PCR test. And in the meantime, I'm just encouraging every single person to get vaccinated who hasn't been vaccinated and to book in for their booster for those people that have. No, we definitely are doing contact tracing at the moment, but it's an automated system. So we've moved through various stages of this disease. So again, if we go back 3 or 4 months, we were looking at every single case, looking at those chains of transmission and making sure that we could chase them down so that we didn't have a situation in South Australia where we had to put the entire state into a lockdown. We were very fortunate. Our contact tracing was at a very high level, and it meant that we didn't have to go into the punishing lockdown that many other states saw. But we're now at a different stage. We're not in the elimination stage, we're in the suppression stage. So we move from optimal to partial TTIQ, test, trace, isolate and quarantine. And so people are now receiving automated messages rather than lengthy interviews where the Communicable Diseases Control Branch will go through all of the details of where you have been. It's just a different stage of this disease, and this is in line with public health protocols that are accepted and delivered right around the world.
Can you just clarify how someone is meant to know if they're in close contact under these exceptional circumstances? How do they know?
Yeah, so look, obviously if they're at a transmission site, that will be published. So we do have one circumstance in South Australia, for example, recently where 9 staff in the one workplace had developed the coronavirus. That's a transmission site, and so it's one where those other staff will be determined as close contacts.
Encouraging people to get vaccinated.
Tell me what to do.
Why are there isolation times?
Sorry, you'll have to just take that down for a second.
Who's encouraging people to get vaccinated?
Yes.
Why are the isolation times now the same for vaccinated and unvaccinated?
Look, that's certainly the advice that we have received from our public health officials.
Thank you for that. That's wonderful.
Premier.
You don't know even.
Premier,
Sorry.
can you just,
So we just go here first.
If someone goes out tonight and they catch up for a drink and they spend half an hour or an hour with someone, and that someone turns out to be positive, are they a close contact?
No, they wouldn't be from a state perspective, but they need to take into account whether they were wearing a mask, whether they weren't wearing a mask, whether they were indoor, outdoor, whether they were vaccinated, non-vaccinated. They'll need to make their own assessment. And personally, I think anybody that is meeting with somebody that turns out to be positive really needs to think very carefully about whether they do isolate ahead of a test, especially if they develop symptoms.
But what about this?
How do people comply?
Sorry, I can't hear
People
you.
are making their own assessments. What encouragement is there for them to comply?
Well, the encouragement is that people in South Australia have done the right thing for right throughout this entire process. So I expect that to continue. We've had all of the catastrophisation out there where people said nobody's ever going to QR code check-in anymore. Nobody's going to have PCR tests. Actually, we've got them at record levels in South Australia. People want to do the right thing here in South Australia, and I'm very grateful for that. This is a troubling situation for the entire world at the moment, and obviously we are also concerned. That's why we're taking action. That's why we put further restrictions in. I know that they're harsh, especially at this time of the year, but we've got to do everything we can to keep South Australia safe.
Can you please explain to the general public how they are supposed to understand these rules when you say one thing, Professor Spurrier says another thing, and then someone else says another thing again? Just wondering how the general public is supposed to understand these rules when they're so confusing.
So look, we're at a different stage of the disease than where we were previously, and as you know, we were putting rings around rings in South Australia trying to stop the spread of this disease. It's not the same now. We're trying to suppress that down. We're obviously looking at those high exposure sites and making sure that we put those people into close contact. Also, household and intimate partners need to go into close contact. Beyond that, in South Australia, we have two exceptional areas. One where they've got vulnerable cohorts, and of course the other where we've got transmission sites which have been identified. Professor Spurrier, I think, has issued or is in the course of issuing some further guidelines to clarify the situation for people, because people would probably come out of yesterday's National Cabinet and think, okay, well, I'm not living with that person, I don't have an intimate relationship with that person, so of course I'm not going to get infected. Well, that's not the case. That's not the way this disease works. So we really need to provide the very best public health advice to these cohorts, and that's precisely what we're doing.
Is it insensitive and tone deaf for SA Health to encourage people to isolate in another home? Not everybody has a big house they can go to.
No, and of course that is the situation, and that's why we have kept a lot of our hotel quarantine capability and capacity for those situations where people don't have an alternative. Sometimes they're living in a house with many people and they just don't have that opportunity, or sometimes they just need additional support. And so we do have quite a number of people who could be isolating at home in our Medi Hotel environment in South Australia, so that we can provide that support to all South Australians that need it.
Can I just follow on from Hannah's?
No.
Obviously, concerned about the respect of the child.
You just pulled that down, so just ask
I
the question,
understand
sorry.
that you want to respect the privacy of the family. There are a lot of families over that concern. How do you
No, look, I'm not going to be making a comment on this, and I'm not going to be providing commentary at this point. It has been referred to the coroner, but I had a meeting with Professor Spurrier this morning, and she again emphasised to me that we really do need to respect this family's privacy at this time. They have been contacted already by media. It is proving to be extraordinarily distressing for this family at their time of grief.
So what is your message to parents who are worried now and aren't going to leave the house? What's their message to them? Are they safe?
Well, look, all I can say is, we are in a dangerous period right around the world at the moment with Omicron. It's a game changer. We're going to just ask everybody to do everything they can to slow down their mobility, come into contact with as few people as possible, maintain that social distancing, use that QR code, use your masks, work from home. This is a pretty tough time for families and for businesses in South Australia. It's one of the reasons why we are looking to lean in to support those businesses that have been affected by the most recent restrictions, particularly those in the tourism, the hospitality and the fitness sectors who are bearing the brunt of the pretty tough restrictions that were put in place on the 26th of November, 26th of December, sorry.
Can I just ask you, where is Professor Spurrier and why isn't she here looking to
So I've met with Professor Spurrier this morning. It's fair to say the AHPPC and other national bodies are meeting on a daily basis. Professor Spurrier was at her desk this morning. So was Chris McGowan, Stephen Wade. We had presentations this morning also from SA Pathology Dr. Tom Dodd and some of his support staff, in particular Kimberly Humphrey, and then we had a presentation this morning on the private hospital arrangements through Lynn Cowan. We had the Commissioner and the Deputy Commissioner on the line, the Treasurer and myself. So the COVID Ready Committee is meeting on a daily basis, but there are far better things for that team to be doing at the moment in terms of expanding our testing capability, expanding our vaccination capability in South Australia, and making sure that we can keep South Australians safe.
Do you not think it's important?
Are
Sorry,
you and Dr. Spurrier on the same page?
No, 100%.
So, just clarifying, Premier, is it not an important thing for Professor Spurrier and the Commissioner to help explain these very confusing rules to the public rather than sitting at their desk when people are screaming out for
Well, look, just let's be a bit more respectful there. They're not just sitting at their desks. They are working to save lives in South Australia.
The 94-year-old
Yes.
was she?
My understanding is yes, but I understand that death has now been referred to the coroner, but we don't have a response from the coroner at this stage.
As well, in terms of isolation
Yes.
rooms, bear with me, they're a bit confusing. A parent, for example, if their child tests positive, they're required, to keep those for 10 days. We could see parents quarantining with their children for more than 17 days. Because when a person in their household tests positive, their 7-day post-contact isolation period resets. The second person in their home tests
Yes.
positive again, it resets again. What's that about?
Well, it's about protecting lives.
But we could see parents, isolating for up to a month. Is that fair?
Well, there's nothing fair about this disease, nothing fair about this disease whatsoever. But it's also not a time to say, look, I know that's not fair, so you're infected, go out and infect somebody else. That is not what public health is about at this stage of the disease. As you can see, there's a very significant escalation in new positive cases right around the world at the moment, right around Australia, and we're not immune from that in South Australia. So we've got to take positive action to protect lives in South Australia, and that's precisely what we'll do.
What's this going to do for testing? I mean, yesterday it was all about, we're going to ease the testing crunch. Now we've got these changes back in effect. It might be 15 minutes, it might be 4 hours. What's this going to do for our testing loads? Aren't we just going to see, scenes like we've seen for weeks, months?
Well, I'm very proud that in South Australia today we had a record. Today we're reporting a record number that went through the system, through the laboratory. Yesterday we're seeing that pathology services around the country are under real pressure. In fact, several of them are scaling back their capacity. South Australia continues to surge forward. Don't forget, just 2 weeks ago we were processing 2,000 swabs per day. We're now over 25,000 in South Australia. So I'm very grateful to SA Pathology and our private pathology labs in South Australia for the great work that they're doing, especially under such trying circumstances. And I'm particularly grateful that they're looking for other opportunities to keep the facilities open during these punishing weather conditions that we have in South Australia. One of the things that I am very pleased about is that as of tomorrow there will no longer be a requirement for those people that are travelling to Queensland to have that negative PCR test. That was taking up about 1,500, 1,700 of our capacity every single day in South Australia. It was completely suboptimal from a public health perspective for our state, and so that is going to be obviously providing us with additional capacity. But I think, as can be demonstrated in South Australia, we are always looking for ways to flex up that capacity. That's what's occurred over the last 3 weeks in South Australia. I'm very grateful to Associate Professor Tom Dodd and his team at SA Pathology for the great work that they're doing.
Wasn't the whole point of a national approach to not see the scenes that we've seen, the 8, 9 out of 10 waiting times? And now people are confused. I spent half an hour with a positive case. I spent an hour. I will go and get a test. Wasn't the whole idea of a national approach to ease the testing squeeze? So
the simple message at the moment is that people need to go and have a PCR test if they've got symptoms. That's the number one message to all South Australians. And so asymptomatic testing for those people that are not close contacts is unhelpful. We've seen a huge number of surveillance tests for people that are travelling interstate or for people who are going in for medical procedures, and we're working with the medical sector in South Australia to make sure that we can move them over to rapid antigen tests rather than using the PCR test. It's an adjustment. we are all dealing with this new variant. Omicron is a complete and utter game changer, and so we're trying to, during this transition period, get people away from using the PCR tests inappropriately. I'm very grateful that yesterday we saw a big reduction in the use of PCR tests, and I'd love to see that again today for those people that are asymptomatic, that are not close contacts, so that we preserve it. We're going to try everything we can to flex that number up, but we also need to preserve that number for the people that most critically need it.
But
You're saying close contacts need to get tested, and then you're saying it's up to the public to determine in many circumstances whether they're a close contact. I'm sorry, how would you understand?
Yeah, look, I think it's pretty simple. I'm sorry if I haven't been able to explain it to you very clearly, but we've got a national approach which is uniform. We've got exceptions by state. We've put guidelines out in South Australia for further information for the public in South Australia. I appreciate that this is a confusing time for people. I appreciate that some people would like to have black and white answers. That's not the way that pandemics work. We're at the suppression stage of this disease now. We're into preserving as many lives as possible in this state, in this country and around the world. I still believe unequivocally that in terms of the response to this disease, this is one of the safest places in the world to be at the moment, but that's only going to continue by everybody working together and to adapt to this changed situation that we now have because of Omicron.
This one might be easy to answer. What's the Big Bash going?
I don't have any information that would suggest it won't.
Does Sydney has to be rugby players?
Oh, you probably know more about this than I do, so that would be a matter that needs to be considered.
Premier, has there been any discussions, or can you rule out any discussions of a lockdown?
There have been no discussions with regards to that.
Can you rule out a lockdown?
Sorry?
Sorry, can you rule out a lockdown?
I said there have been no discussions with regards to that.
If you're an international arrival currently in personal quarantine, are you pre-quarantine?
Well, no, if you're in a hotel, then you would actually be unvaccinated. So that would be the situation, because it was...
If you're doing home isolation, you're doing quarantine because you're an international arrival, you're fully vaccinated, are you pregnant?
So we still need to have a negative PCR test. So those people that were in South Australia, I think they were doing 72 hours as of the 28th, and they could be doing that in home if they were fully vaccinated. They would still need to have a negative PCR test to go out and about. That's the change in direction that will come into effect as of midnight tonight.
I've got experience of this being an outbreak.
Yes. I wouldn't say outbreak, but there's been a positive case, either of a worker or a resident in a large number of aged care facilities. But an outbreak is something quite different. There haven't been outbreaks in 15
How
years.
many residents?
I don't have that data for you, but I'm sure we could follow that up today.
An update on what's happening at the women's prison, where there's been a positive.
Yes, so there was a positive case which I was asked about yesterday. I didn't have that information, but after I finished the press conference, I was informed that yes, there had been a positive case. This was somebody who had already been in isolation. They've now been transferred out, and certainly from a health perspective, there are no real concerns with regards to that prison.
You talk about people who don't have symptoms, don't get a PCR test. Yeah, don't do that. You're clogging the system. But
Monitor symptoms.
Sure.
Yeah.
But SA Health says if you are a close contact, which seemingly they need to work out themselves, then you should get a PCR test on day 1 and 6. Is that mixed messaging?
Well,
What's
look,
going on?
you know, it's difficult. I know you want one single simple message, but the reality is it is variable. If you have had dinner with somebody who is symptomatic and a positive case, you find out 2 days later you've had a 4-hour dinner with them in an intimate relationship, I think that the likelihood is you probably got a high chance of getting it. I'd be getting a PCR test.
Premier, can I just ask you about rapid antigen tests?
But just so you know, there are millions and millions of different variations of that precise matter, and so you cannot be providing a matrix on every single outcome. What we do know is there are some hard and fast rules. If you're a household or an intimate partner, you need to be in that close contact designation, and similarly with those other 2 exceptional cases, and beyond that there are so many different permutations. And I think the people in there's not one person in South Australia who wants to be positive and not doing the right thing, and so I think that's why we're issuing the guidelines over and above what's been published from the National Cabinet. I'm sure other states are doing exactly and precisely the same thing, because we know how transmission occurs. It's not possible to be at the same level we were in terms of monitoring and designation from 4 or 5 months ago. It's a different stage of the disease, and people are going to have to look at their own personal circumstances and see what that risk could potentially be. Yes.
Some supermarkets are selling a pack of 5 rapid antigen tests for about $90.
Yes, this was the question yesterday.
Yeah, sure.
My answer's the same today.
So can I just ask, therefore, can you explain how general members of the public can afford rapid antigen tests like that? And what's your message to supermarkets that may be abusing opportunities?
My answer today is exactly the same as yesterday. Yes. No, we don't have that situation in South Australia, so there's no requirement on release in South Australia. We do have a differential position from the federal setting, so they were announced yesterday after the National Cabinet they'd have a rapid antigen test at day 6 before a day 7 release. They've updated their position. That was never South Australia's position. Ours was 10-day with no requirement for PCR for release.
Post-contact isolation time 7 days or so.
What's that, sorry?
Post-contact isolation time is it 7 days for both vaccinated and unvaccinated?
It is as of last night, yes.
Can you explain that?
Yes.
What was the thinking behind that?
Well, again, this was a decision and a recommendation that was given to us by SA Health, and we're happy to implement it. It's in line with the other situation around Australia. So most places around Australia all moved out. We've got a very small number of people that are unvaccinated at the moment, and so that was the decision which was taken at the national level. It's mirrored here in South Australia.
What's your message to people going out tonight?
Stay safe. Look, it's going to be a very different New Year's Eve for South Australians and Australians tonight compared to virtually every other year of their life. My strong message is you can still have fun, but do it in a safe way. 2021 has had some highs. It's certainly had some lows. I appreciate the situation has been very, very tough for many people, but we still do live in a very safe place in South Australia. We are confronted with a mighty challenge with Omicron at the moment, but I'm confident that we'll be able to rise to this challenge just as we've been able to rise to the previous waves that affected the world so disastrously, and I expect that to continue into the future. I'd now like to pivot to talking about support for businesses in South Australia. As I said before, we have a huge number of businesses, particularly in the hospitality, the tourism and the fitness sector, which are really under enormous pressure with the restrictions that have been put in place. Now, we've demonstrated in South Australia in the past that we've been able to support those businesses to get through those tough times, to create a bridge from one set of circumstances to the other. I'd like to thank the Treasurer and Treasury, the Cabinet yesterday, for approving a package, a pretty expensive package, but an important package to support businesses in South Australia. There will be a range of support ranging between $6,000 and $8,000 for smaller businesses and $20,000 and $22,000 for larger businesses, which will come into effect next week. So we'll start to see that money flowing as of next week to support the businesses in South Australia which are doing it particularly tough at the moment. There's also a range of other things that we'll be doing. In particular, we'll be looking at waiving licensing fees and also deferring payroll tax obligations for those businesses in those sectors which are so adversely affected. But now to give the detail, I'd like to hand over to Rob Lucas, who will give that detail, answer any questions, and I'll be able to come back and answer any final questions that you might have. Thank you, Treasurer.
Premier, as Premier's just outlined, we're announcing today a package of grants. This is the 7th cash grant package. There's been other assistance we've provided over the last 2 years with land tax deferrals and waivers, workers' compensation premium payment waivers and the like, but this is the 7th scheme in relation to which involves cash grants. As the Premier's just indicated, there'll be 2 levels of cash grants. At the maximum level, it'll be $20,000 or $22,000 in total grants payable to tourism, hospitality and gym or fitness related businesses. An extra $2,000 if you're a CBD business, given the fact that the government's decision to encourage people to work from home means that clearly foot traffic and office workers within the CBD have significantly reduced since the imposition of restrictions. So at the maximum level it'll be $20,000 or $22,000. At the lower level for lower turnover businesses, $6,000 or $8,000 in grants. They'll be paid in 2 tranches. We'll automatically make immediate payments without application so from next Tuesday, first business day next week. So businesses from next Tuesday will automatically receive the first half of those payments. So if you're a lower turnover business, you'll receive $3,000 or $4,000. If you're a higher turnover business, you'll receive the $10,000 or $11,000 immediately without application. And then there'll be an application process based on a 30% reduction in turnover. And if you qualify and you can demonstrate that your turnover has been impacted by the imposition of the new restrictions, the density restrictions in particular, you'll qualify for the remaining payments. So a maximum level payment of $20,000 or $22,000 significantly increased on past payments, and through, as I said, $6,000 or $8,000 for lower turnover businesses. The threshold for turnovers is the same as the one we used last year, which is a $2 million turnover. The second range of assistance that we'll provide for the tourism and hospitality industry in particular, as the Premier indicated, is a waiver of liquor licensing fees. We've already waived 6 months of their fees this year for everything other than bottle shops or drive-throughs. We'll waive the other 6 months of liquor licensing fees, and the payroll tax deferral for the January through to March quarter can be deferred with payment to be entered into with Revenue SA from April of next year. The other grant schemes that we're announcing today are, there's a business hardship grant scheme. So the assistance that I've just outlined is essentially for the tourism, hospitality and gym sector, which are the ones most immediately impacted by the density restrictions. But if there are any other businesses in any other industry sector which can demonstrate that there has been a significant reduction in their turnover as a result of the density restrictions, there's an application process, and there can be grants of up to $6,000 or $8,000 if you're a CBD business, if you happen to be in another industry sector, not tourism, hospitality or gyms. And then thirdly, there is also a major events a grant scheme. We introduced one of those 3 or 4 months ago, which pays grants of either $25,000 or $100,000 for people who might have organised an event between December 26 and January 27 over that month period, and if they have significantly incurred costs and made losses as a result of organising an event which has to be cancelled, there's a process of application, and grants of up to $100,000 can be paid to the organisers. It doesn't compensate for losses of potential profits on a particular event that someone might be projecting, but it's there intended to try and cover as much of their cost base that might have already incurred as well. So there's a range of assistance. The government, as we have done, as I said, this is the 7th scheme, depending on the length of these particular density restrictions, and that's not finally determined at this particular stage. It will depend on how we, the state and the nation, manage Omicron. The government will obviously keep under notice as to whether or not we provide another round of cash grants later on in the month or early next month.
How many businesses do you expect to be eligible?
Well, it's impossible to give you a final. We know that there's roughly 3,000 or 4,000 businesses who will pre-qualify for automatic payments, because we're working on the basis they've previously demonstrated need through our previous grant schemes. We know their ABN numbers, their bank account details, and therefore we can make an immediate payment to those 3,000 or 4,000 businesses. But in relation, for example, to the business impact fund that I talked about, which is for businesses other than tourism, hospitality and gyms, we have no idea how many businesses in that particular category might qualify. So we just will have to wait and see. Upon application, it's open-ended. We don't have a cap on it. We'll pay whatever number of businesses there are that meet the qualification period, which we've used before and we're going to use again.
Have you had any modelling, or was there any discussions, Treasurer, about how this will affect the budget bottom line in the longer term?
Well, not in the longer term, because these payments are going to impact the budget bottom line this year, and as you know, we're already budgeting for a very significant deficit this year. This will add to that deficit. Our estimated cost at this stage is around about $40 million, but we have no idea in relation to the other industry sectors what the cost, the number of businesses and the cost will be, so it could be higher or it could be lower than that. It will add to the deficit this year, but it doesn't change our forward estimates in terms of next year and the remaining 3 years, the forward estimates, where we're budgeting on returning to modest operating surpluses in those particular years. These grants are needed now. They'll be paid in this particular financial year. They'll have an immediate impact on this financial year's budget, but no ongoing impact in relation to the forward estimates over the next 3 years.
How much consultation did you undertake with businesses to come up with this?
Well, I've had discussions with the AHA in relation to some elements of the package, in particular the liquor licensing fee, but essentially these schemes and arrangements are modelled on the schemes that we've used for the first 6 schemes, so they are well ventilated and well understood by people in the community. I highlight the fact that an alternative scheme has been suggested of up to payments of up to $500 a day. Our $22,000 grant, of course, would be the equivalent of 6 weeks of those $500 a day payments, but we'll be able to process it much more quickly than upon application, because half of that will be paid automatically as from next week, rather than those businesses having to come up each day or each week, I'm not sure how the scheme is meant to operate, and argue that they want another $100 a day or $500 a day or whatever it might happen to be. No, well, I think the state's economy is the strongest growing economy in the nation, compared to, so for the period through to June of this year, South Australia's economic growth was 3.9%, the strongest growing economy in the nation. I think probably the first time, one of the very few times that's ever occurred in South Australia's history on the basis of full year's economic growth. So there are challenges for particular industry sectors because of the density restrictions. We understand that, we acknowledge it, and the calls for the government to respond have been principally for those industry sectors like tourism and hospitality, gyms, dance studios, yoga and the like, where restrictions of 1 per 4 square metres or 1 per 7 square metres clearly will significantly impact the capacity of those businesses to operate for so long as those density restrictions are there.
Exactly right. Is this sustainable? I mean, if the restrictions go on ever more, you don't want to be talking out support package after support package. What happens
Look,
next?
this government has said, this is the 7th package. We've said all along we've got 2 priorities: save as many lives as we can, and we've done remarkably well there, even with the sad circumstances of the last 2 days, and then to save as many jobs and businesses as we can. We can't save them all, but we've done remarkably well, as our economic growth figures show, and the fact that our unemployment figures dipped significantly in terms of the unemployment rate, dipped significantly in the last figures as well.
Do you anticipate any effect on GDP or unemployment from these restrictions, Pedro?
Oh, well, clearly nationally and in South Australia there will be an impact on unemployment figures. In terms of impacts on GSP or GDP nationally, that'll depend on the length and the extent of restrictions. So the challenge for us as a government and other state and territory governments and the national government is to manage the onset of Omicron as best as we can. Our health priority is obviously number one. Saving jobs and businesses is an equivalent priority for us as well. All right.
Thanks a lot.
Thank you.